Thank you. Okay, so hello, my name's Stephanie John and I'm a senior lecturer from Swansea University. I'm here today to speak to you about the imposter syndrome and why we question our competence. Now, the imposter syndrome is something that may or may not be something that's familiar to you all, but let's establish whether that's the case or not. So, what will be addressed during this presentation? Bear with me a second. So we're going to be looking at what imposter syndrome actually is, the reasons for and the symptoms of imposter syndrome, the effects of imposter syndrome on well-being and career, and recommendations to help nurses deal with the imposter syndrome. So let's first of all establish what the imposter syndrome actually is. So the term imposter syndrome or imposter phenomenon was first defined by Clance and Imes back in 1978. So it's something that's been around for quite a long time. And they defined it by saying that many high-achieving women doubt their expertise and feel that they fooled others into believing that they're more capable than they actually are, rather than placing merit on their own achievements and feeling as if they deserve them. So it's said to be experienced by 70% of the population at some point in their lives, and that includes men and women. So where initially we were focused on women, we're focused on the population generally now, so focused on men and women who experience this. So it presents as feelings of inadequacy and unworthiness, and the inability to accept one's accomplishments. So what does it feel like? So you can see by this infographic here that the assumption is, if you experience imposter syndrome, that you know a lot less than everybody else, and you think that other people know a lot more than you, when actually in reality, what you know and what other people know are relatively equal. It can also feel like this. So someone may ask you how you're doing, and you will tell them that you're absolutely fine. But in the back of your mind, you're thinking, I suck. I don't know what on earth I'm doing. I fooled everybody into thinking that I'm more capable than I am. I need to stop trying because nobody likes me. So these are all feelings of self-doubt, and self-doubt feeds the imposter syndrome. So here are a few famous people who experience the imposter syndrome, and that allows us to establish that we're not alone in relation to these experiences. And you'll see that there's both men and women on this slide here. So you've got people as famous as Lady Gaga and as seemingly confident as Lady Gaga and Meryl Streep, and also Tina Fey. But you've also got Tom Hanks and Robert Pattinson. So very, very successful people who you wouldn't necessarily associate with having crippling self-doubt, which is again feeding into the imposter syndrome. So it's always comforting for us to know that regardless of how successful people are, they still experience them anxieties. So an important fact, imposter syndrome exists in men, but it actually flourishes in women. Now, the reason for that is unclear, but it's speculated that it might be the case that for women, concepts such as self-doubt and low self-esteem seem to flourish more, which is why then naturally the imposter syndrome would also flourish. So despite this, however, it does also present itself in males, and increasingly so. Now, how accurate this is up for debate, because the very nature of imposter syndrome is such that we try and hide our inadequacies. So if we've got self-doubt or crippling anxieties in relation to our self-esteem, we'll tend to try and hide those self-doubts and things. So whether we've got an accurate perception of the prevalence of the condition is two different things. So you can actually establish whether you suffer from the imposter syndrome, and you are also able to establish to what extent you suffer from the imposter syndrome. Now, this is a hyperlink, but what I will also do is include the actual link to the Clance and IM's self-assessment inventory in the notes section of this presentation. And also my contact details will be there. So if you did want to explore whether you are suffering from the imposter syndrome and the extent to which you are, you can by all means email me and I can forward you this link for you to establish that. So you're probably thinking, is the imposter syndrome relevant to me? So you may already, based on the description, be thinking, yes, it is. That sounds exactly like me. But also, we need to address that imposter syndrome often appears among nurses at any point in their career. It's particularly common in newly qualified nurses or those who even progress in the profession. It's therefore relevant to everyone, those who mentor, those who manage, and everyone in between. So you yourself may experience imposter syndrome, or it could be a colleague who is crippled with that self-doubt that's feeding into the imposter syndrome. So newly qualified nurses, let's look at that first. So newly qualified nurses are particularly vulnerable. Many already doubt their knowledge, their readiness for qualification, and also themselves. So that's something that's quite common in student nurses as well. So it would be relevant to both those groups of individuals. Imposter syndrome eagerly feeds on self-doubt, which is naturally experienced during an adjustment period. So when you're adjusting from being a student nurse into the role of qualified nurse, obviously a period of discomfort will ensue from that, and imposter syndrome actively feeds on that, unfortunately. As a consequence of that, then there's a fear of failure, but there's also a fear of succeeding. So that will obliterate someone's confidence to try and develop further. So if, for example, you plan to progress, the consequences of progression may mean that you doubt yourself more. So those who suffer with imposter syndrome will probably avoid that progression to try and avoid them feelings of self-doubt and that negative feelings towards themselves and their esteem, and also to avoid their competence being questioned as well. So, as I said, these feelings feed the imposter syndrome and vice versa, which then is a vicious and a draining cycle. So you can imagine how challenging that must be for an individual who is experiencing those feelings, particularly when they're already battling with the pressures of their professional role. And unfortunately, as a result of that, many new nurses will leave the profession believing that they're unable to hack it. So that has massive implications in relation to nurse retention. So let's look at now nurses who choose to progress and how vulnerable they are. So these could be nurses who are already qualified, and they could be at any point in their career. They could be going into a new role, or they could be progressing within the role that they're already in. So progression results in increased responsibility and increased expectations. Now, undoubtedly, that's going to have an impact on how you feel in terms of your ability to carry out your role and how competent you feel within that role. So you may have been an expert in one area, then a movement into another professional field, or perhaps professional progression may make you feel again like a novice. So that then is going to feed the imposter syndrome. Progression will also result in increased visibility, so making you more seen by your colleagues, which obviously if you are experiencing the imposter syndrome and the very nature of it is to hide inadequacies, this is going to be something that's very, very daunting. Increased progression also results in a need to delegate. Now, when you're delegating others, that increases the likelihood that your competence is going to be questioned. So again, that's something that feeds the imposter syndrome. So it has massive impact. So this is important to address the impact of imposter syndrome, because the impacts are so substantial. It can lead to depression and anxiety, burnout, which is already a problem within the nursing field, poor retention, again a problem already within the nursing field and in a range of contexts and settings. So we want to keep as many nurses within the profession as we possibly can, so we need to address the impacts of imposter syndrome. Maladaptive coping strategies. So are we thinking about healthy ways to deal with how we're feeling? So some people could perhaps turn to alcoholism, for example. As mentioned, in relation to depression and anxiety, psychological stress is also caused by the imposter syndrome. A reluctance to progress and reach potential, which could be then defined as self-sabotage or self-handicapping behaviours. So self-sabotage, for example, could be that we intentionally don't strive to meet our goals, or we actually put barriers in the way to stop us from meeting our goals. And self-handicapping is quite similar to that. So what we don't want to do is achieve our goals or attempt to achieve our goals and risk failure, which then lowers our self-esteem and feeds again into the imposter syndrome. So moving on from that, but a similar sort of concept at how vicious the cycle of the imposter phenomenon or the imposter syndrome is. We've got the Clance cycle, the imposter cycle. So we start at the top left and we consider achievement related tasks. So things that we need to do to progress or things that we need to do to improve our career or our professional development. That leads us then to experience anxiety, self-doubt and worry in relation to achieving that task. So that then can result in either over preparation or even procrastination. So I'm sure that all of you are familiar with either one of those or even both. So I'm a terrible procrastinator, and then what happens then is that I procrastinate so much, I panic about it, and then I over prepare at the last minute. As a result of that, then perhaps we will accomplish what we aimed to accomplish and experience a feeling of relief. However, we soon start to put that down to the fact that we put in so much effort because of the over preparation, or that our success in that achievement related task was down to luck. So we discredit ourselves. We put it down to other things other than our ability. And then as a result of that, we discount positive feedback that we receive then from other people. So then that feeds into the imposter phenomenon. And it feeds into that perceived fraudulence and that we're a fraud and we've fooled everyone into thinking that we're more competent than we are. That increases our self-doubt and can lead then to depression and anxiety. And then that takes us back then to the beginning where we need to do another achievement related task, and then the cycle starts again. So when I mentioned earlier about the imposter phenomenon being a vicious cycle and it's very draining, this is why. So based on that, imposter anxieties might partly explain the high numbers of nurses who are leaving the profession and high job turnover rates, not only in clinical practice, but also in the educational. So many lecturers, for example, will leave the profession because they experience imposter phenomenon associated with the transition from clinical practice into the educational context. So when practitioner and faculty shortages are already an issue, that has huge consequences, particularly when we need nurses, we need a nursing workforce, and we need to prepare the next generation of nurses. So this is a syndrome which is particularly relevant to anyone who is involved in that process. So what can we do? It's important to establish what we can do about problems such as this. So just putting a name to an experience helps us accept it. So just through delivering this presentation and highlighting the imposter syndrome, some of you may be familiar with it and some of you maybe not. However, you may be thinking about the description of the imposter syndrome or imposter phenomenon and thinking, yes, that's me. So just putting a name to it will help you accept that you are suffering with that. Awareness is key. So we need to raise awareness, as that allows us opportunities for the imposter syndrome or imposter phenomenon to be managed. But as I mentioned earlier, identifying imposter syndrome is very challenging because the very nature of it means that we go to extreme lengths to conceal what we deem to be our inadequacies. That has detrimental effects. So we need to make sure that then detrimental effects are highlighted so that we can consider coping strategies in order to deal with them. We need to normalize the experience, as we can only achieve that through open communication with regards to imposter syndrome and raising awareness of that. So we need to normalize it. Let's talk about it. Let's make it something that we all recognize in other individuals and perhaps in ourselves. So who can help? So everybody can help. So as I mentioned, there could be yourself or a colleague who is experiencing imposter syndrome. So let's talk to each other with regards to our self-doubt and our low self-esteem. But also we can consider the role of managers, mentors, or based on the new NMC standards, practice assessors and supervisors, and preceptors are also very useful individuals who can help. And that's because they are probably best positioned to offer support and encourage a realistic self-view, because imposter syndrome is based on an unrealistic self-view that we are not competent, when the chances are, if we are in a professional role, then we are there for a reason. We've demonstrated our competence to allow us to do that job. How can you help? So discussions about performance should address low self-esteem, which is at the heart of imposter syndrome. So we are very, very good at talking about how we're doing, but we don't tend to formalize the management of confidence issues. So in doing so, we may be able to manage the imposter syndrome. We should be highlighting that feeling incompetent and being incompetent are two very different things. And formal reflection within the appraisal process could be a practical means for individuals to explore and discuss their own credibility. So people with low confidence are very likely to benefit from discussing their qualifications, their experience and their expertise that has led them to being in their current role, because they probably haven't got there by accident, but they will put that down if they're experiencing the imposter syndrome to that achievement and that success related to fooling everyone or luck. So why help? So helping people who experience the imposter syndrome, or even helping yourself, so taking it upon yourself to establish suitable coping methods, will reduce job turnover rates, actually improves job satisfaction, improves employee performance and well-being. So we all know that at the moment, well-being is a very challenging concept, particularly in the work environment. So anything that we can do in relation to helping that is going to be a positive. That's then in turn going to benefit clinical practice. It'll benefit nurse education, and it'll also improve patient outcomes overall. So in summary, here are some of the key points from the presentation. So the imposter syndrome presents as feelings of inadequacy and unworthiness in relation to professional roles, or it could be in a general context as well. Progression into a new role can bring with it a period of discomfort and self-doubt, which again feeds into that imposter syndrome. Newly qualified nurses who progress in their field, and nurses generally are likely to experience the imposter syndrome. It's very destructive and can compound staffing issues. So we did cover some of the issues that we can experience as a result of imposter syndrome. But acknowledging and discussing self-confidence issues may help to manage imposter syndrome. And formalizing the management of self-doubt and confidence concerns can improve the outcomes for everyone, including our patients.